thank you to all our subscribers and to everyone preparing for their exam. We wish you all the very best. You can do this. Just keep practicing, and by God's grace, you will nail it at your first attempt. Alright, so in this video, I'm just going to be talking about, I'm going to be carrying out a scenario on pain assessment, which is one of the skills that you can have in your husky. It's a very short and a very simple skill, and it's just 6 minutes. It's a talking station, so you're going to be having either a mannequin or an actor. You're not expected to write anything in this skill. All right, so we have a short video that talks about the pain assessment. It talks about the PQRST, which is basically what I'm going to be doing in this video. The P stands for provoke, Q stands for quality, R stands for radiate, and the S stands for severity. The T stands for time. And remember, it is 6 minutes, so you really have to work on your time, because basically you have to talk about the PQRST. All right, so they will tell you, assessor is going to tell you that you should assume that all the pre-checks has been done, so you don't have to do the identity check or your sin safety or whatever, because you don't have the luxury of time in this station anyways. All right, so let's go on now. I put an ampoule of gel in my hand. I rub palm to the back of my hands, vice versa, fingers interlocked, vice versa, my palm to palm, and then my fingertips in rotational manner, vice versa, my thumb rotational manner, and vice versa, my wrist in rotational manner, vice versa, and I allow my hands to air dry for 30 seconds. Now my hands are dry. I'm just going to be reading the scenario before we go and meet our patient. So you are working in medical assessment unit. Fred Lutana, with hospital number 001234, date of birth 11/1990, was brought from the accident and emergency department as he fell down the stairs and sustained a fractured femur. He has been complaining of severe pain to his left leg and lower back. You will need to complete a comprehensive pain assessment of Fred. All identification checks have been completed and the patient has no known allergies. You are not expected to administer analgesia. Please carry out a comprehensive pain assessment using the universal pain assessment tool provided to ascertain the severity of the pain. You are required to use your assessment to develop an appropriate plan of action. Please discuss with the patient. You do not need to document anything in this part of the station. However, you may take notes using the page provided should you wish. You have 6 minutes to complete the station, assuming it is today and it is 11:30 hours. So you're going to have your scenario, which is your question, so to say, and then you're going to have the pain assessment tool chart as well. All right, so let's go and meet our patient. Hello, good morning.
Good morning.
My name is Funke. I'm one of the nurses that will be attending to you today, and I'm here to carry out a pain assessment on you. Is that okay?
Yes, no.
All right. So, Fred, if I may ask, where exactly is this pain?
On my left leg, nurse.
Oh, is there anything that makes the pain better or anything that makes the pain worse?
When I move it, it hurts badly, nurse.
I'm so sorry to hear about that. We ensure that we try as much as possible to stabilize your leg, to reduce any complication and then the pain as well. Okay, so talking about the quality of this pain, will you say the pain is dull, sharp, bony, or throbbing?
It is sharp, nurse.
Oh, so it's a sharp pain. Oh, okay, I see. And does it radiate to any part of the body, or is just on this left leg that you talk about, or does it go to any part of the body?
Yes, it is affecting my lower back.
Oh, I'm so sorry to hear about that. So if I ask you to score this pain on a scale of 10, with 0 being no pain at all and 10 is the highest pain, what will you score it, Fred?
8, nurse.
Oh, so sorry to hear about this, Fred. That is a very severe pain. I can acknowledge that you are in pain, Fred. You said it's radiated to your lower back. Do you mind if I just put a pillow behind your back, Fred?
Yes, nurse.
Oh, okay, all right. How does that feel, Fred?
It feels better, nurse.
Oh, that's good to know. And have you had any painkiller for this pain at all?
Yes, but it doesn't seem to be working, nurse.
Oh, okay. I'm so sorry to hear about that. I'm going to be checking your match chart. I'll see if you're due for any other painkiller. I'll be giving that to you, but if not, I'm going to be escalating to the medical team to prescribe another painkiller for you. And if you don't mind, Fred, I'll be referring you to the pain management team for further plan of care. Is that okay?
Yes, nurse.
Oh, all right, that's good. Fred, when exactly did this pain? Did it start?
After I had fell down the stairs, nurse.
Oh, I see. And has it been constant or is just gradual or does it go and then come back again, Fred?
It's been constant, nurse.
I'm so sorry to hear about this, Fred. Like I said, I'm going to be giving you, we'll try as much as possible to give you your prescribed analgesic. And if there is none, I'll definitely escalate to the medical team to prescribe another analgesic so that we can get on top of this pain. But I want to assure you that you are in safe hands. I will try as much as possible to immobilize your leg as well to prevent the pain and to prevent further injury as well. Is that okay?
Yes.
So Fred, have you got any question for me at all? Any concern?
No, nurse.
All right, thank you so much for your cooperation, Fred. I'll be coming back in the next 30 minutes to do another pain assessment. But in the meanwhile, I've got this buzzer. So if you need anything, you just press the buzzer and either me or one of my colleagues will be right here to attend to you. Is that okay?
Yes, nurse.
All right, so thank you so much, Fred. I'm going to perform my last hand hygiene. I'll put an ample of gel in my hand. I roll palm to the back of my hands, vice versa, fingers interlocked, vice versa, fingers interlaced with palm to palm, my fingertips in rotational manner, vice versa, my thumb in rotational manner, vice versa, my wrist in rotational manner, vice versa, and I allow my hands to air dry for 30 seconds. And that is it. Simple, isn't it? It is simple and it's a very short one. Thank you so much for watching. We wish you all the best in your exam. Bye for now.